My name is Ariella Hader, physical therapist and Pilates studio owner of Pilates Sante in Los Gatos, California. And today I'd like to just share with you about 10 minutes of exercises that you can do if you've been diagnosed with sacroiliac pain. Ideally at this point, a practitioner has helped you align your pelvis, whether that's a chiropractor or physical therapist, and then you're following that with lumbopelvic stabilization exercises. We'll start on our hands and knees for this, finding a nice neutral position. You can rock the pelvis a couple of times, and then find a sweet spot that's somewhere in the middle in your neutral spine. If you have a sacroiliac issue, one of the things you want to consider is really avoiding extension. So if you need to even come up past neutral into a little bit of flexion, that's okay initially. And then from here, keeping the pelvis as stable as possible, take an inhale into the ribs, and then as you exhale, draw the belly and extend through one leg. Just feel the pelvis staying stable here. And then from here, move the leg out to the right and back to center. You're moving the leg as far as you can to one side without letting the pelvis rotate and without letting the spine sway or arch. You can do small circles here. 3, 2, 1, and reversing. And holding, extending the opposite arm out, hold, and then we can draw in and extend out for bird dog. Good. And as you're doing this, really start to focus too on the stabilizing leg, the stabilizing hip, avoiding shifting too much weight to that direction. So right now, my left hip is my stabilizing hip, and I'm thinking about moving it slightly to the right to turn on my outer hip abductors. I'll hold here, and then come on in. Let's even out. Check in with the pelvis again. Take an inhale. Exhale, extend the leg out. Both my hip bones are pointed straight down. Lower belly is engaged. Abduct the leg any amount. And back to neutral. And again. And 2 more like that. And last one. Good, small circles right here for 5, 4, 3, 2, and 1, reversing it. How stable can you keep your pelvis as you're working here? And then hold, extend the opposite arm out, and feel that cross-body connection between the back of the right shoulder and the left gluteal. Draw the knee and elbow in without placing weight. Inhale. Exhale, extend and lengthen. 3 more like that. Creating this connection in what's called your posterior oblique sling. And then continue to think of your supporting hip, my right hip moving slightly to the left to turn on my right hip abductors. Hold this last one with 1 more breath. And come all the way in. You're welcome to do 2 or 3 more rounds of pelvic stabilization on your hands and knees. We're now going to turn onto our back for some bridge work. So again, we'll work here with a non-rolling bridge. We're going to lift the hips up as one unit. And as you do this, you should really consider the height of the bridge. You should not feel any local sacroiliac pain. If you need to keep your bridge low, that's fine. Create a lot of length from your knees out of your toes. And then we'll just lower by hinging at the pelvis, release your bottom, and then engage and exhale. Let's just do 2 more bridges like that, really anchoring through the heel and the big toe. And feeling your hips stay level. No stress in the sacrum. Stay up now. We'll bring your right leg up to tabletop, keeping your hips level, and lower it back down. And then left leg, just alternating march. Good. Feeling the gluteals support the pelvis and avoiding dropping of the hips or the pelvis as you alternate sides. This time, keep the right leg up. Hold here. Really focus on your left glute stabilizing you. Extend through the right leg. Exhale. Inhale, come back in. Really trying to maintain my right hip bone staying elevated here while my left glutes engaging. Good. Last one, extend out. Place the right foot down. Hold here. If you need to lower the hips to rest a minute, feel free. Otherwise, we lift the left leg into that 90-degree tabletop position. We exhale to extend the leg out, keeping the hips level. 4 more. This is where we often find imbalances, where one side is more challenging than the other. Often it's the symptomatic side that's a little more challenging, but not always. We'll place that left foot down, hold your central bridge, feel both gluteals working together with your lower abdomen, and then lower the hips back down. Good. And you're welcome to do 2 or 3 more sets of that same gluteal stabilization with your bridges. We're going to go on to our third exercise now, which is 90-90 abdominal tabletop exercise. Lots of variations here. If bringing both legs up to tabletop feels too challenging at this point, you are welcome to keep one leg down. We're going to start here by just, again, making sure you're in a nice neutral position. Avoid extending into the spine and feeling that local SI discomfort. If you need to even tuck a little more toward flat, you can. If you need a little additional support for the back of the neck, that's okay too. Take an inhale here, keeping the hips level. You're going to exhale, fan one leg out to the side. Avoid rotating off of your right side of your pelvis and back in. Let's do that again, just with the left leg. Exhale, open, keeping the right side of your pelvis stable. Inhale back into tabletop. Good, 2 more like that. Exhale, open. Inhale, close. 1 more, exhale, open. Inhale, close. We'll switch sides. And if you need to use your hand to kind of help support that side of your pelvis, check in with your abdomen, that's okay too. We exhale, the right leg moves out, keeping the left side of the pelvis anchored. Really connect to your left lower abdomen as the right side moves away. And back in. Continuing your breath work with an exhale and an inhale. 1 more, creating the work and the resistance with your leg against the air, like you're moving through something thick. Inhale here, exhale, toe dip. 1 leg comes down, both sides of the pelvis are stable. Inhale, alternating sides. Exhale, hover. There's no change in the back and pelvis position. 1 more on each like that. Excellent. We're going to take it into isometric press. Right hand presses into the right thigh. Inhale here. Exhale, reach the left leg down. This should create a little more engagement now. And back up. We'll stay on the same side. Good. If you want additional challenge, consider an arm reach overhead. Let's do 3 more like that. I'm pressing into my right thigh as my left arm and left leg move away from each other. 1 more, exhale, keep that rib to pelvic connection. And inhale. Good, draw knees into chest, give a little squeeze if you need. Bring the legs back to tabletop, press the left hand into the left thigh. Inhale here, exhale, reach the right foot down to hover. Inhale, float the leg back up. 2 more. Quivers are good. Trying to really feel a drawing inward to the midline of your body to create a connection on the exhale with your lower transverse abdominis. Take the hand up. Inhale here. Exhale, right arm, right leg, reach away. 3 more like that. One more. And back in. hug the knees into the chest. Those are 3 basic series that you could do either as a circuit or multiple sets at a time to create stability on all sides of the pelvis to create a more stable SI joint. Thank you so much.